Dr. Mirudhubashini Govindarajan from Women's Center by Motherhood at Coimbatore. As far as women are concerned, there are many issues that we look at. Being significantly overweight is one of the first problems that we look at. A woman who has carrying medical problems is the next issue that we look at. And when it comes to the reproductive organs, the things that we look at, reproductive organs and functions, the things that we look at first is ovulation. Ovulation is production of an egg in a particular cycle. A lot of women with irregular cycles do not produce eggs normally. For example, a woman who's got very regular every month cycles will be producing eggs only on 12 days in a year, that is on 1 day a month. So that will be the time she'll have to try to achieve a pregnancy. And if that does not happen, if a woman is having a cycle every 2 months, you can imagine that that number is drastically reduced to 6 days in a year, and that's not very much. So therefore, regularity of the cycle and regularity of ovulation is one of the first things that we look at. And ovulation today is not an unusual thing at all. Polycystic ovary is becoming much more common. Polycystic ovary is a genetic condition, but however, when a woman with that type of a gene puts on too much weight, her cycles become even more irregular, and if the cycle goes to 2 or 3 months, the number of days that she is likely to ovulate gets cut down drastically, and she may not even be ovulating at all. So this is one of the first factors that we look at. The second factor that you look at and check for is tubal patency. Tubal patency can be affected by a lot of different infections that can happen. One of the common infections in India is tuberculosis. Tuberculosis happens in certain parts of the country more often than others. So such things will need to be ruled out, and tubal patency has to be accomplished, and this is done by an X-ray or an ultrasound or sometimes even a laparoscopy. Uterine problems need to be ruled out by doing appropriate ultrasound examinations. Hormone testings need to be done by appropriate blood tests, and adequacy of the reserve in the ovaries of adequate number of follicles needs to be checked out as well. In the man, we start out with his general health as well as the semen analysis being the key, but many men need further investigations in terms of an andrology consultation. Andrologists are specialists who treat men with fertility problems, and these specialists are quite often needed to look at the problem more adequately in men who have issues. It may be sexual problems, it may be fertility problems, but they need to be checked out properly before the treatment is started.